For me, my next step will to really push and put our leaders accountable for the specific policies that are already existing, so that they be implemented to the latter.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll. So thank you very much for coming in today. This is going to be a short round of conversations, primarily talking about your experience as an advocate, the areas that you are advocating in, and exploring a little bit of what your journey has been as a digital health advocate. But without further ado, welcome to the African NCD Champions Podcast, where we talk about non-communicable diseases, leadership, and talk to incredible people doing different works on non-communicable diseases. So as we start, could you give us a brief introduction about yourself, who you are, what you've done, and then we'll move into the work itself.
Great. I am Kelvin Mokaya, a communications enthusiast and a digital advocate in the spaces of alcohol, campaigns against alcohol, campaigns against tobacco, campaigns against trans fat. Yeah.
Good. So let's dive in a little bit into your campaign. Tell us a little bit of your experience. How did you end up becoming a digital advocate and a communication enthusiast? What's your story?
First of all, I come from a space of reproductive health and rights. And it's something that is very wide. I've been able to work with several organizations, and it has been a learning experience for me. Coming into the alcohol space and tobacco space, and more specifically the transfer space, is that really trying to bring change in our populace. And now looking at the Kenyan context. What are some of the decisions that people are making without them knowing that they are really hurting their health, or rather they're making uninformed choices on their health? And that's why I decided that this is a space that I would really want to venture, because these are things that individuals are consuming. The public are buying and they are consuming, and it's really jeopardizing their future in some way, and most specifically their health. And now I decided that it's something that I can do.
Yeah, so what are some of the organizations, institutions, and perhaps even campaigns that you've engaged with in the past in your journey as an advocate?
Now more specifically on the tobacco space, and the alcohol space, and also on the trans fat, looking at the food issues, food policies, I've been able to work closely with the ILA, that's the International Institute for Legislative Affairs. And the institution itself has been able to build not just me, but us as digital advocates, by being exposed to various instruments that ensures that our work is flowing in the right manner. And I feel the impact has been realized, especially to the beneficiaries of the projects that we've been able to engage in. Yes, and of course, there are partners like SCAD and the rest, KETCA, NTA,
So what has been your biggest, or of all the things that you've campaigned on as a digital advocate, what topic has been your most favorite and why?
I feel that I've really come very close with the campaigns on tobacco, because I've been able to experience, not really firsthand, but how it has affected my community, So having been raised and brought up in one of the biggest slums in the country, and now in Africa, these are things that I was seeing that are happening in the community. But now being exposed to some of these trainings that I've gotten, then I came to realize that it's something that people should really talk about. They should really engage with these localized policies on tobacco, because it either affects you or someone that you know. And again, when you look at smoking tobacco, if it doesn't affect you directly as a smoker, it affects you as a non-smoker. And the aftermath, the impacts are rather kind of the same.
Yeah. What would you say have been some of the key messages in your journey as a tobacco advocate or an advocate against the use of tobacco? What are some of the key messages that you usually share with your audiences, and what are some of the reactions that you've seen from your audiences when you share these messages?
I wouldn't want to really mention the specific messages, but what has really stood out over time, like recently we had the graphic health warnings on the use of tobacco, like the results. So some of these graphics really show what are the end results of using tobacco. So putting this out there to the public, and the reactions, of course, from the opposition, is that we are not using the real narratives that are supposed to be out there in the public. And of course, negating the fact that that's the reality. So for me, it has been, I will say, challenging but a learning experience, because even if I walked in an hospital today, I'll see some of these graphics there. So I'm imagining the people who are ignorant of the fact that tobacco kills, tobacco causes cancers, and a lot of cancers are involved with tobacco, or rather directly influenced by the tobacco use. So for me, that has been an eye-opener to really speak boldly about the use of tobacco, which shouldn't be happening, especially to young people. Yes.
Yeah, on that line, I know you started to mention a few of them, but why should people in general not use tobacco? Why is tobacco a bad item, and why should we keep away from tobacco?
Tobacco kills in itself. I haven't in my few months of advocacy against the use of tobacco, I have not come across benefits of using tobacco, whether medicinal or anything. So number one, so tobacco kills. And tobacco causes cancers. Tobacco causes throat cancer, lung cancer. It's involved, or rather, it's a
risk factor.
It's a risk factor for
many
cancers. Which is already proven. It's scientifically proven. So those in itself shows that tobacco shouldn't even be a consumable product in our public domain. Yes.
Yeah, I mean, personally, I also hate the smell of tobacco in general. People who use tobacco have very smelly mouths.
Yes.
Which is also something that I find very abhorring about the use of tobacco in general. So, as we come to a quick close, what did you say are some of the biggest achievements that you've had as a digital health advocate?
For me, I would quote that it's good to mention that most of our advocacy messages have found themselves in the memorandums that have been presented to the legislature for specific actions, and in regards now, now we recently had the financial bill, and we've seen gains that are there in the tobacco clauses and also in the alcohol clauses. So for the fact that I will be really advocating for issues in the digital spaces, but again, these key messages find themselves in making position papers, in speaking out through memorandums. So for me, it's a big gain. Yes.
Interesting. And what do you see as your next steps in your journey as a digital health advocate?
For me, my next step will to really push and put our leaders accountable for the specific policies that are already existing, so that they be implemented to the latter. Yeah, so it's a process, and it's not an easy do, or rather an easy task. But I believe advocacy is always growing, and always being there to ensure that we are working in not in silos, but we are having the same voice. We are moving in one accord, but ensuring that our leaders are working for the public good, and most specifically for the health of the public. Yeah.
All right, cool. So, final message. What did you say? Are your closing remarks? As especially for other young people who might want to become health advocates and digital health advocates, to be specific. What did you say are your closing remarks, and how can they get into the space?
For me, my closing remarks, more specifically to young people who want to join the spaces that we are in, is that it doesn't take much for one to even think about creating change. And worth noting is that once they are there, they will experience resistance, more specifically from the people that they know, if they're not speaking the same language or if they don't share the same vision. But it's the thing is that they need to get really focused and push for the agenda, if at all that agenda is for the good of the public. And joining the space, the first step is wanting to create change, not just for yourself but for your community. And if you have young people at heart, then you'll be able to push for agendas that will ensure that our future is more healthy than what we experience right now. Yes.
All right, cool. And I think that brings us to the end of this mini-sode. Thank you very much for coming and for sharing with us.
Thank you.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.